My topic for paper presentation is Patterns of Late Gadolinium Enhancement in Genetic Cardiomyopathies, a genotype-phenotype correlation. Genetic cardiomyopathies are a heterogeneous group of inherited heart diseases with varying phenotypic presentations and clinical outcomes. Cardiovascular magnetic resonance imaging, particularly with late gadolinium enhancement (LGE), has become a key tool in the non-invasive evaluation of myocardial fibrosis, which plays a critical role in disease progression and prognosis. The aims and objectives are: this study mainly focuses on the patterns of LGE observed in different genetic cardiomyopathies in patients undergoing CMR. It aims to delineate characteristic pattern of different genetic mutations and also to identify the genotype-phenotype correlation in Indian population. It is a retrospective study which analyzed data from 50 patients with genetically confirmed cardiomyopathies who underwent CMR with LGE. CMR imaging was performed on 1.5 Tesla and 3 Tesla MRI. LGE was assessed using standard late gadolinium acquisition protocols, and fibrosis patterns were categorized based on location, extent, and distribution. Whether there was a correlation between LGE patterns and genetic phenotypes was analyzed. Few cases. Case 1 is a young male with history of chest pain and elevated troponins. Here we see extensive mid-myocardial and epicardial late gadolinium enhancement. What is to be noted is the smooth and regular margins. Here we see ring-like epicardial LGE. We see increased values on pre and post-contrast Steven mapping. Again, increased values on T2 mapping are noted. On genetic study, we saw desmoplakin gene was positive for this patient. So ring-like epicardial LGE with more than 3 consecutive segments in a single short axis slice. We should raise possibility for a genetic cardiomyopathy. In case 2, we have 22-year-old male patient who complains of chest pain, uneasiness and vomiting, who was admitted with ST elevation MI. He was thrombolized and a normal CAG was seen. Here we see dilated heart with poor ejection fraction and some hypertrabeculations. Here we see near transmural LGE along the inferior wall. We should notice that this LGE is not restricted by a coronary territory and immediately think that this is something abnormal. On genetic testing, we found Titin gene positive and OBSCN gene positive. Case 3. This is a middle-aged man with breathlessness on exertion and edema in the feet, arrhythmia on ECG, and catheter angiography was normal. Here we see again a dilated heart with poor ejection fraction and segmental dyskinesia involving both ventricles. On late gadolinium enhancement, we see global subendocardial and transmural enhancement. Again, not restricted to one single coronary territory, raising the possibility of something abnormal. Extensive enhancement is seen, not fitting into a coronary territory. On genetic testing, we saw MYBPC3 gene positive, which was likely pathogenic. So my results are, there were 36% females and rest males. The age of the patients, 16 patients were in the age of 30 to 40 years, 13 were in the age group of 40 to 50 years, and 21 patients were more than 50 years of age. The patterns of LGE that we observed were no late gadolinium enhancement in 23 patients, 15 in mid-myocardial, 8 in subepicardial, and ring-like epicardial in 3, near transmural in 1 patient. The genes that we found after genetic testing are: no gene was found in 12, titin in 11, desmoplakin in 4, MYH7 in 5, DMD in 3, and 15 genes in others distributed. So the imaging phenotypes: in case of desmoplakin genotypes, finding of subepicardial ring of LGE represented a specific imaging hallmark. In FLNC genotype, 2/3 cases showed subepicardial LGE. In Titan genotypes, majority patients showed mid-myocardial LGE, both linear and patchy. We did not find any specific LGE traits that could help in the distinction between individual non-desmoplakin, FLNC, or Titan genotypes due to the heterogeneity of this group and relatively small sample size of each individual genotype. The distinct pattern of LG can offer valuable insights into diagnosis of various genetic cardiomyopathies. Early diagnosis and appropriate management of high-risk pattern can help to reduce incidence of sudden cardiac deaths. This study includes cases with confirmed genetic testing only. Analysis of these patients of late gadolinium enhancement and correlating them with genetic mutation will help to identify high-risk cases. Genetic predisposition contributes to 30% of premature deaths. Genetics influence the cardiovascular system in a profound way. Improved understanding of diseases will help in better management of patients and reduce sudden cardiac death events. There is a significant overlap in different phenotypes. So, this was a similar study that was published by European Society of Cardiology, where we saw patterns of late gadolinium enhancement in genotype positive cardiomyopathy. So this study mainly aims on the value of genetic testing. We should do cascade family screening, targeted monitoring, which will help in early diagnosis and early treatment, which will also refine the treatment recommendations and moving forward to gene-specific treatments and family planning. Varying clinical presentations have overlapping imaging findings. We can take an actionable plan for high-risk genotype that will reduce mortality, reducing sudden cardiac death events in family members, and improved understanding of the disease. Thank you.